Well, maybe when you were younger, you had beautiful, long, full eyelashes, but for some reason they seem to be disappearing, or maybe you're concerned about your eyebrows, using a little more pencil these days than they used to. So where's that hair going? Dermatologist Fred Quarles joins us now. He may have the answer. You can call with your skincare questions. The number is 673-5420. When it comes to your eyelashes and eyebrows, are we talking about a skin care issue because of the follicles that are in the skin, or what's going on?
Yeah, well, in terms of eyebrows and eyelashes, eyebrows can be lost from over plucking and doing too much to shape the eyelashes over the years, which can lead to scarring and thinning. But then you can have a situation where the eyebrows become less over a short period of time, and it could be an immune response to your hair, where your hair comes out in spots and the eyebrows are involved. And then also you can have thyroid disease, which can sometimes contribute to hair loss on the scalp, eyebrows, but rarely the eyelashes. And then there are those who sometimes have a psychological or psychiatric problem where they're plucking because they're stressed. For the eyelashes, there is a product called Latisse, which can help lengthen your eyelashes, and not just, it's not a mascara, it's something that actually helps the eyelashes grow.
Side effects?
The side effect of Latisse is very minimal. In a few patients, they've had some discoloration of the iris of the eye, and that's very rare. But in a recent study, some people who have discoloration on their skin where they've lost the pigment in their skin with a disease called vitiligo, they're finding this eyelash product has even helped some of the pigment return. I saw that recently. Yeah.
All right. Deborah from Yorktown has been so patient waiting on the phone. What's your question for Dr. Quarles?
Hello, Dr. Quarles. I have a question about hyperpigmentation. I have some, I'm African American, and I have some on my legs, and I have some on my back from acne scars. Are there any treatments available to eliminate that?
Yeah, well, there are topical medicines. We call them hydroquinone is the active ingredient in all the over-the-counter fading creams. In certain countries around the world, it's been banned because it's been labeled as something that may cause a problem, but all the studies have shown that that's not the case. But hydroquinone is what can be used for fading, and you can get prescription strength at 4%, and I can write prescriptions for that if it's necessary. But in skin of color, post-inflammatory hyperpigmentation is a sequelae of just about everything that injures the skin. Whether you burn your skin, you have mosquito bites, or whether it's acne. That's the second part, or the tough part of even treating people with skin problems in skin of color, trying to do something about those dark spots. But there are fading creams that can be prescribed.
All right, good news. And Fred, Dr. Fred Quarles can write you a prescription for one of those creams if you'd like to talk more with him about that or other skin concerns that you have, or if you're concerned about your eyebrows and eyelashes. You can reach him in the Virginia Beach office, 490-6635, or find him in Hampton, 827-3046.